Welcome to the talk. Today we're going to be discussing all things pelvic health, which is an area of women's health that is highly underserved, not well known about, I would say, even though I live in Canada. And it's something that is a passion of mine. So I'm a pelvic floor physiotherapist as well as women's health advocate in Calgary, Canada. I've been working with women during pregnancy as well as postpartum for over 5 years. And it is one of the phases of life that I think is so special, and it is an honor for me to work with every single patient of mine. I have realized over the past few years that there is a lack of information available during pregnancy as well as postpartum for how to prepare for labor and delivery. How do we recover fast? And the information out there is quite convoluted. It might not be based on evidence and research. And most of the time, there are tons of courses out there that you have to pay for. So this information is not freely available. So that is the point of this talk. The point is to give you information so that you feel you can make the best decisions for your health and you feel empowered. Okay? To give you an idea about what we are going to be talking about over the next hour or so, we're going to be discussing the pelvic floor. So what is it? What are these muscles? Where do they lie? What are their function? And how can they be impacted during pregnancy, labor and delivery, and postpartum? Common signs and symptoms for you to look out for, whether you are prenatal or postpartum. That would give you an indication of, either I need to seek help or something is going on that I need to pay more attention to in my body. Okay, then we're going to be going over the benefits of preparing for labor and delivery. So what are the benefits and what are the certain tools that we can use to prepare, including perineal massage, either by yourself, using fingers, or with a pelvic wand with your partner. Okay, the benefits of using pushing techniques and breathing techniques, as well as Kegels. So Kegels is a big topic everybody wants to learn about. So we're going to be going over today how to do a Kegel, which I'm excited about. And then postpartum care. So whether it's C-section delivery or vaginal delivery, postpartum care is so important. So we're going to be talking about that. And then finally, how physiotherapy can help you. Okay. And at the end, I can address any questions that you might have. So I am going to show the first slide here. So yes, again, that's just the session outline that what we're going to be going over, and we're going to jump right into the pelvic floor. So the pelvic floor is a set of muscles that is deep inside the body. Okay, and it runs from the pubic bone from the front all the way to the tailbone, and acts as a hammock or a sling to support the organs inside. These muscles hold your organs in place, and they actually control their function. So they're controlling bladder function, sexual function, as well as bowel function. And these muscles are a little bit different than other muscles in your body. Okay, so if we think about the heart, which is a muscle that is beating 24 hours a day, the pelvic floor muscles are similar to that. They work all day long, and the only time they're supposed to relax is when you go to the bathroom. So for urination or bowel movement. So if you think about that, then if they're relaxing at any other point in time, that may be an indication that something is going on, and that they might not be functioning the way they are supposed to. And then additionally, on top of that, so during pregnancy, what's happening is there's additional weight on these muscles for 9 months, and labor and delivery can be straining to the muscles. If there's any tearing, that can impact them. And so that is why women during pregnancy and postpartum are more at risk of developing pelvic floor conditions and signs and symptoms that we are going to be talking about shortly. Okay. Just want to show another picture of the pelvic floor because the other one makes it seem like there's one muscle inside. There's actually a ton of muscle inside, okay? So here you can see this is actually how much muscle we have inside, and it's just good to know about that because I think a lot of people either think, the pelvic floor muscles, there are minor muscles just around the urethra or the bladder to control them, but there's actually a ton of muscle inside that is supporting you. Okay. The pelvic floor and the core. This is something that I like to highlight quite a bit. Okay. I have had tons of patients come in postpartum, even during pregnancy to me, and they might point to their abdominal muscles. They might say, you know, Nav, my pelvic floor, my abdominal muscles and my core is feeling weak. Can you show me some exercises for that? So most people believe that the core consists just of the abdominal muscles, but in fact, the pelvic floor is a critical part of that. So your core actually consists of your back muscles, okay, which is where it says multifidus there. It's just basically defining which muscles it is. So the back muscles, abdominal muscles, the deepest layer, which is the transverse abdominis. So that's deeper to the muscle that is kind of seen as the six-pack muscle, your hip muscles, your diaphragm, which is a huge muscle that helps with breathing and connects with the pelvic floor, and then your pelvic floor muscles. So anything in that mid area, that middle region, is a part of your core, and it's just important to identify the pelvic floor as a part of your core because everything in the core is connected. So if you're having any issues, either, you know, back issues, pelvic floor issues, hip issues, groin, lower abdominal issues, and we're going to be talking about these more in detail in a minute. Yes, it could be coming from that specific area, or it could be coming from a different part of the core. Okay, especially if you find something is not resolving, then that could mean that it's actually coming from a different part of your core. Okay, I'm going to do a poll right now. So I would just like to know if you knew before this talk that the pelvic floor is a part of the core. Okay, it's just good information for me to have. Yeah. Okay, so we're leaning towards right now. So it's about 70 percent, 71% no, and 29% is yes. So that's just very, very important, I think, to keep in mind, especially as you go through certain exercise programs that you may have signed up for, either prenatally or postpartum. If you're signed up for a core program, you know, Pilates program, what are they actually targeting when they say core? Because a lot of times when someone is mentioning and saying core, they're talking about the abdominal muscles, but we just want to make sure it's gone up now. 73% is no. Just want to make sure that we are addressing the pelvic floor anytime we're strengthening the core. Okay. So we are going to move along to pelvic floor conditions. Okay, so there is a handout. Again, I just want to remind everybody. So if you click on handouts on the left-hand side, there's a list of conditions and their definitions for reference, including the technical terms. If you have any of these symptoms, I would highly recommend seeking care because it's just important to make sure we are taking care of our bodies. Okay, and I am always about prevention. So if you don't have any of these symptoms, that's amazing. That's great. We want to keep it that way. But it's just important for you to then know exactly what each sign and symptom is. So if it does develop, then you know to seek care. Okay, so the pelvic floor conditions that we're going to go over, I've listed them there, and I'm going to go into depth for each one. So the first one we're going to talk about is leakages. So when I see leakages, and on the handout there it says incontinence, so that's what it means. Incontinence means leakage, and we're going to be talking about urine leakage, so bladder leakage, as well as bowel leakage. Okay, so stool. Bladder leakage is something definitely that we see more of during pregnancy and postpartum. Bowel is much less, but I still want to address it. Okay, so when I say leakage, I mean leakage of any amount. Okay, so it could be a few drops, it could be more than a few drops. I've had clients say that they've fully emptied their bladder when they did not want to. Okay, regardless of how much it is an indication that the pelvic floor muscles are not doing what they are meant to do. And we just want to investigate it, even if it's a few drops, to prevent it from worsening. Okay, this can happen just sitting around randomly. It can happen with walking, with exercise, jumping, running, lifting, whether it's lifting weights, something else, lifting your baby. And regardless of what it is, if there's any leakage coming out, just pay attention to that. Okay, the other type of leakage I forgot to mention, and I just want to go over it, is gas leakage as well. I've had clients say that gas is coming out without, and that's involuntary, right? And that is also related to the bowel area. The next one is urgency and frequency. So that's bladder urgency and bowel urgency. Again, we see much more of bladder urgency and frequency, I would say, than bowel, but I do want to address both. And increased frequency is definitely expected during pregnancy because baby is literally pushing down on bladder. Okay, but if you feel like you have to go to the bathroom every 15 or 20 minutes, if you feel like you have to rush to the bathroom, if you feel like you cannot make it there on time and a leakage is happening before you make it there, that is a concern. Okay, it's either a sign that the pelvic floor muscles are tight inside, okay, and they're telling your bladder, they're telling your body to go to the bathroom repeatedly, okay, or the pelvic floor muscles might actually be weak and they cannot support the organs, and anytime the bladder is feeling can't support that, and then you have to go to the bathroom, okay? Or they could be tight and weak at the same time. I know that's a weird concept to think about, but muscles can become tight if they are overworking, and as a result of that, they just tighten up. Okay, so it could be one of three options there. Chronic constipation is the next one I want to talk about. So this one is multifactorial. Okay, so diet can be related to that if there are any digestive issues, IBD, IBS. Okay, but if you're finding with bowel movements, diet is pretty well controlled, that's not an issue. There's nothing else going on. Then, in fact, it could be the muscles that are tight inside around the rectum that are leading you to feel like you have to strain. Okay, so if you find you have to push, you have to strain excessively, this may be a sign of pelvic floor dysfunction. And there's actually a muscle that goes around the rectum that has to loosen up for you to have a bowel movement. The thing, though, that happens is for most people, when you cannot have a bowel movement, and it's so frustrating, and I know this because I have experienced chronic constipation in the past, then we lead to pushing and straining because that's the only way it's going to happen, right? But if you push and strain against any muscle, usually what happens is the muscle tends to react to that and get tight, okay? And then that means you have to push more, and it can become this vicious cycle, okay? So straining can lead to hemorrhoids, okay, as well as pelvic organ prolapse. This is something we're going to talk about in a minute. So if you are experiencing constipation, there's a couple things that you can do. First one would be to do belly breathing. Okay, so that's where you're trying to relax the pelvic floor muscles, okay, instead of straining against them. And then the other thing would be to use a stool. Okay, so you're going to use a stool underneath your feet so that your knees are elevated slightly higher than your hips. That actually puts that muscle inside at an optimal position so it can loosen up. That's why a lot of people in different countries, if they don't have toilets, they're squatting. That's actually the best position to be in for bowel movements because the muscle is completely relaxed. Okay, so I'm not asking you to squat, just use a stool. If your belly is, you're like, that doesn't feel comfortable, the other thing you can actually do is just lean forward so that your elbow or arm is on your knees and do the belly breathing. That should help significantly. It's helped me. I usually recommend that to most of my clients if they have chronic constipation. Okay, but please try to avoid straining because it may lead to pelvic organ prolapse, which is the next thing that we are going to talk about. Okay, so I'm just changing the slide here, and I will refer to this in a second. But we just want to define prolapse, and I know it's there in the handout as well. So what is prolapse? So prolapse in this context means something is coming down. So what is this something? Those are the pelvic organs, okay? So the bladder, the bowel, or uterus. If the pelvic floor muscles cannot support, they are weak, the connective tissue cannot support, then the pelvic organs can start to descend towards the vaginal entrance. I know this sounds very scary, but it is just very important to know because 50% of women postpartum vaginal delivery have some degree of prolapse. With C-section, we do see prolapse as well, but not to the extent of vaginal delivery because there's a few different factors that come into play. One is, is it an emergency C-section? Is it unplanned or planned? Because the reason we can see it with C-section is because there might have been a phase where you were still pushing, okay, and that can lead to the organs descending and put strain on the muscles, okay, but regardless of that, we still see it in post-cesarean section as well. Prolapse is very important to know about because 9 out of 10 of my patients coming in do not know about it. I feel this is an area that I love educating about because we just don't know about it. No one really talks about it. I've had physicians as patients come in and they said postpartum that their OB didn't talk about it either. So it's just something that I like to educate about quite a bit because I have worked with women in their 50s, 60s, 70s at a urologist's office. So that's a specialist doctor that takes care of bladder care. And it was routine for me to see women coming in and telling me, you know what, Nav, this is going to sound scary, but my bladder is coming out. I can see it. I can feel it. There is bulging. I have to push it back inside. And I'm all about prevention. So if I'm seeing anyone during pregnancy and postpartum, we are working at prevention for other symptoms as well, but especially pelvic organ prolapse. So what are the signs and symptoms of pelvic organ prolapse? So heaviness and pressure in the vaginal area, feeling, this is going to sound crazy, feeling like there's a bowling ball inside the vagina, feeling like the vagina is going to fall out, seeing bulging, feeling it at the entrance, difficulty actually with completely emptying your bowel and bladder because, as you can see here in this picture, so where it says normal, it is showing kind of what I had shown before. So the bladder at the front, and then we have uterus and then bowel. And then where it says cystocele, so cystocele means bladder prolapse, so the bladder coming down. So you can see that the bladder has started to descend towards the vaginal entrance. Okay, so it is very, very, very common for me when I'm doing an internal examination during pregnancy for me to see a little bit of the bladder because baby is pushing on the bladder. But we want to make sure that we are doing certain things, including Kegels, okay, which are pelvic floor strengthening exercises that we are going to go through later. Okay, we're strengthening our pelvic floor to prevent any of these issues from happening. Okay, so that is just a big thing that I like to talk about. The other things that can lead to prolapse, I actually mentioned one of these before, chronic constipation, having children because we are pushing, chronic coughing, okay, and repetitive lifting that is heavy lifting, okay? But thankfully, Kegels have been shown to reduce the rate of prolapse and to help prevent. The next thing I want to talk about is pelvic pain. Okay, pelvic pain is a pretty broad term. Okay, it can indicate that the muscles aren't working the way they're intended to work, that they're tight, they may be overstressed and compensating for another part of the core, or the pelvic floor is weak itself. The first type of pain I want to talk about is pubic pain because we see this quite often. So that is pain at the lower part of the abdomen. So if you go a little bit lower, you're going to find there is that bony part there. And if you have this pain, you will know it for sure. So this is pain right at the front there where the pelvic floor muscles attach. And it has also been described as by many people as lightning crotch. It can feel quite sharp. Okay, it can come about randomly, but most of the time it's happening if you are rolling in bed, if you're going from lying down to sitting, from sitting to standing, lifting one leg up to put pants on, or just to, have weight on one side, or if you're bending over and putting shoes or socks on. Okay, so that is most of the time when it's happening. It can also feel like the bone is literally bruised. Okay, the other type of pain at the other end would be tailbone pain. So this is right at the end of the spine, and that point pressure, if you are sitting right now, most likely you are sitting on the tailbone area. And this can be from sitting any amount of time. Some people have it immediately as soon as they sit down. For other people, it could be after 15, 20 minutes or after a long period of time. And particularly from going from sitting to standing, for sitting on the ground, lying down, or recline. So anything that is putting pressure on that area. If you have this pain currently, please assess the surface that you're sitting on. Okay, because the pelvic floor muscles, as they're lengthening during pregnancy, they can be impacted by the surfaces that we are sitting on. So if you're finding you have this pain, I would either use a cushion. Okay, I would change the surface so it's softer versus hard. And or I love recommending using an exercise ball. So you can sit on an exercise ball. If you're sitting at the desk working, sit on an exercise ball a few minutes every day. Focus on belly breathing, relaxing your pelvic floor muscles. That should help. The other types of pain that usually people don't think about as core or pelvic floor pain is low back pain, groin pain, lower abdominal pain, and pain going from the low back into the bum area. It might be shooting down your leg. And this is also known as sciatica, which can cause numbness, tingling, pins, or needles down the legs. Okay. Everything in that middle area is a part of the core. So that low back pain, yes, it could be coming from the low back muscles. It could be coming from the hip muscles, the pelvic floor muscles, the abdominal muscles, anything in that area. Okay, the final type of pain I want to educate about is painful intercourse. So intercourse means sex. Okay, very common during pregnancy, very common postpartum, and actually very common outside of pregnancy and postpartum. I've seen a lot of clients come in, they've always just had this pain. Okay, many physicians, and this is just from what I have heard from my clients saying, many physicians, other healthcare professionals as well, but particularly physicians, I would say are not providing adequate care in this area. Okay, so I've had clients come in and say they were told to just relax, have a glass of wine outside of pregnancy, and just breathe through it. I personally don't think that is adequate care and recommendations if someone is having this pain. So a lot of women are suffering with this in silence. They feel no one else out there has it, or they're not getting proper care for it. This pain can be either at the entrance or deeper in. Okay, it could be at the beginning, kind of goes away. You can feel it towards the end. You might feel it afterwards, or you might be sore afterwards. Any one of those is considered pain with sex and intercourse, and you do not have to go through it. Okay, so postpartum, and depends on the labor and delivery as well. Okay, so postpartum, usually the causes of the pain can be because of either tearing during labor and delivery or episiotomy. So if you haven't heard about the word episiotomy before, it means that they think there is going to be tearing during labor and delivery, so they make a cut. Okay, and that cut in itself, just like any other cut, it has to heal, which can lead to scar tissue. If there's any tearing naturally, that can also lead to scar tissue. Okay, and for both of these, as well as during pregnancy, if you are experiencing pain with intercourse, there are things we can do, including breathing, stretches, and internal massage, which can be a valuable treatment option. And we're going to be talking about this massage in a little bit when we talk about perineal massage to prepare for labor and delivery. Okay, which you can do either by yourself or with a wand, other different options for that. Okay, so I'm going to change the slide. The final thing I want to talk about is abdominal separation. Okay, with the technical term for that is diastasis recti. It's quite a mouthful, so I just put kind of the layman's term there in brackets, just so you know what I'm talking about, and it's in the handout as well. So up to 60% of women have abdominal separation during pregnancy, about 40% postpartum, and I just want to focus a little bit on what abdominal separation is, because we have changed how we define it. We used to think And we used to assess it this way. So if someone was coming in, and I've had clients come in to me and they're like, oh my gosh, Nav, I have abdominal separation. I was told I have abdominal separation. I checked on myself. What can I do about it? Well, the gap that is in between the abdominal muscles actually doesn't matter that much anymore. Okay. We used to say, you know, if there's a 2-finger width gap in between the abdominal muscles, there is separation. We don't go by that anymore. So if you've been told or you've checked by yourself, it has completely changed. We are actually looking at if there's any bulging, okay? If there is anything coming out, if there's a dip along the middle, which is kind of what you can see there in that picture. The traditional gap measurement doesn't apply because it's not a reliable measurement. If I measure, my fingers are totally different than a male physician. So he may say, oh, you don't have separation. And then you come to me and I'm like, oh my gosh, you for sure have separation. Look, I can fit 2 of my fingers in there, but it's not a reliable test. Okay. And beyond that, everyone has a little bit of separation. So if you look at somebody who has a 6-pack, there's that line down the middle. Okay. And for some people it's bigger, for some people it's smaller. So we don't go by that anymore. Okay. How to really self-evaluate for yourself at home when you're postpartum would be if you feel like your stomach is bigger by the end of the day versus the beginning of the day. Okay, so it's getting bigger. If you feel like, you know, you've lost weight, but you still cannot lose that tummy weight, if you feel like you still look pregnant, people are commenting and saying you're still pregnant and you're wondering why you're not able to lose that weight and go back to your pre-pregnancy weight. Okay, the other thing would be if you're doing a crunch or you're doing any type of movement or exercise and you notice there's bulging, there's something is coming out, okay? Or there's that dip along the middle that I had mentioned before. And it's just very important to seek help because diastasis recti, so abdominal separation, usually goes hand in hand with other pelvic floor conditions, such as prolapse, okay? Which is, if prolapse is mild, you're not going to have symptoms. It's more towards the severe end. So if you have any abdominal separation, prolapse may be occurring at the same time, low back pain may be occurring at the same time as well, okay? The biggest thing with many of these conditions and the biggest takeaway that I want you to take from this presentation is that leakages, so bladder leakages, bowel leakages, abdominal separation, as well as pelvic organ prolapse, think about it as pressure. There's pressure coming down, okay? There's pressure in the abdomen. It's called intra-abdominal pressure. That pressure has to go somewhere, and either the pelvic floor muscles or the abdominal muscles are not able to support that pressure, and then that can lead to issues. Okay, so if you think about it as pressure, then I want you to really pay attention to how you're doing certain activities, right? Chronic constipation, make sure you're breathing, not holding your breath and pushing. Labor and delivery, and we're going to talk about this, right? What are different pushing techniques we can do versus just holding our breath and pushing, okay? And same thing if you're lifting something and if you're exercising, please, please, please breathe. So we minimize that pressure inside of us, okay? So at this point, does anybody have any questions? I know we just went through a ton of information. If you do, you can put it in the chat box, okay? Or you can put in the questions as well, okay? But I am going to do a poll, and I just want to start it so that I just want to know, are you experiencing any of the symptoms we just talked about? So leakages, you know, bowel issues, constipation, pubic pain, any of that, okay? If you don't have any symptoms, that's great, then we're working more towards prevention, obviously. But if you have any of these symptoms, you can just put it in there. That'll also kind of give me a good idea. Okay, and I can just relay the percentage to you as we go along. So it seems about 20, wow, this number is quite high. So about 30% of people on here are experiencing bladder leakages, okay? And then in terms of pain, overall, that's another, actually that's about 50% there, with pubic pain, pain with sex, hip pain, low back pain, okay? Only 10% said that they don't have symptoms, okay? So in that case, please pay attention to all the signs and symptoms that I had talked about. Please pay attention to the pressure, and additionally, please seek help. So we're going to be talking about what kind of help we have out there. Okay. So I see a couple things in the chat box. Okay, I had surgery above my belly button for a hernia. Is there risk for abdominal separation because I've had this? That's a great question. I'm not sure if there are studies out there that look at hernia and then pregnancy-related abdominal separation. I personally in the clinic have not seen that, okay? Because most of the time we're working on prevention. So if someone is coming in, I have seen patients come in, they have had hernias and then they are pregnant. We're doing a lot of, pelvic and core strengthening. And once we do that, then yeah, usually most of the time they are good afterwards, but I'm not sure if the risk is higher. That is something I would have to look into. I haven't seen any research studies specifically looking at hernias and diastasis recti, abdominal separation, and the risk of that if someone is pregnant. But yeah, good question. Okay, and then there's some comments about only being able to select a single answer or several. I'll look into that after, but thank you for letting me know. Okay, because it should be kind of standardized between everybody. So you should be able to select more than one thing, but thank you for letting me know about that. Okay. So let's talk about prenatal prep. Okay, so if you have any of these conditions, what can we do? If you don't have any of these conditions, what can we do? I am huge about prevention. I think in general, that's how healthcare should be. We should be focusing on prevention most of the time. And then if someone has any issues, then we should be treating them. Okay, so if we think about that in, I don't know, any other way, so if you think about heart health, right? Doctors are saying, okay, exercise, want you to eat properly, follow a good diet, because we know that can help prevent heart attacks and other issues. But when it comes to pregnancy, where is that information and where is that advocacy really? Okay, I have worked with doctors who do hip and knee replacements, which is a very common surgery here in Canada. Okay, and I would be in their clinic and they would say, okay, so you're going to get this surgery, you're getting a knee replacement. Before you go into surgery, I want you to go and see Nav. I want you to do rehabilitation. I want you to do physiotherapy, because the stronger you are going into surgery, the faster you're going to recover after. Pregnancy, there's pressure on your muscles for 9 months. Labor and delivery, depends. It might be C-section. If it's vaginal delivery, is there tearing? The muscles are being strained. Is there an episiotomy? Vacuum-assisted forceps, right? There is no real advocacy for doing physiotherapy, and beyond that, even just doing strengthening or going to another healthcare practitioner to prepare and to recover faster. Okay, so this is something that I like to talk about in different ways. There are different ways to prepare. Okay, first one would be perineal massage. Then we have pushing techniques and Kegels. So let's talk about perineal massage. The perineum is the area between the vagina and the anus. Okay, and that's where a ton of muscle attaches. Usually if there's any tearing, that's where it happens. And so we want to ensure that we are taking certain measures to reduce and prevent that tearing. And research shows doing perineal massage can help prevent tearing, especially for first-time moms. So different ways to do perineal massage. Okay, first one is with your partner. Usually they recommend starting perineal massage at 34 weeks onwards. If somebody has pelvic pain, we start it way before that. Okay, because it's a pain management technique that you can also use doing internal massage. So you could do it with your partner. They recommend about 3 times a week. Okay, about, I would say, half of my clients are doing it that way. Okay, the other way is doing it by yourself. Okay, so if you're able to reach down there by yourself, you can do that. Most of the time, it's harder to reach down there by ourselves. And in that case, I know that looks very scary. That's a pelvic wand. So if you're going to be doing pelvic massage, perineal massage by yourself, I highly recommend getting a wand to massage the areas. And I'm actually going to show you the one that I recommend to my clients. Okay, so this is going to look super scary. This is what the wand looks like, exactly like the picture that I am showing. And the biggest thing to take away from that is the whole thing does not go inside. Okay, it's just this part that is going inside the first few inches, and it's curved for a reason. So whenever I'm doing massage or I'm teaching massage to my clients, they're going to be doing it by themselves using their fingers or with partner or any other type of massage. If I'm doing neck massage, my fingers aren't straight, right? So to really get into the muscle, you need to have that curved finger. That's why it's curved here. Only this part goes inside. The rest is for you to hold, okay? Because it's super hard to kind of like try to navigate and go around down there, especially if your belly is bigger. Then you basically hold the wand at the end here, and you can have that leverage. So that is what that is for. Due to, okay, I just want to address this. I never thought I would be doing this. So due to basically price gouging by other retailers, I have now, as of last month, started selling the wand, which I never thought I would be doing as a pelvic physiotherapist. So if you look online, you're going to see that the wand at some places is being sold from anywhere from $80 to $175, which is insane. That's crazy. I don't think you should have to. So you're already doing so much stuff during pregnancy. You're preparing for postpartum. You're buying a lot of things for your baby, for yourself. You should not be paying $200 for a wand. Okay. I'm selling it on my store. So I have a store now online for $40. Okay. And shipping would be on top of that unless you're in Calgary. You can just pick it up from one of the clinics. You can come in person, that is fine. But I would highly recommend a couple of different things. First is discuss with your partner if you can do a massage together, okay? See if you can do it by yourself down there as well. If you're finding there's any difficulty reaching down there, you should not be straining. We just talked about this. You should not be straining with massage. It can lead to pressure, making the muscles tighter. If any of that happening, getting a pelvic wand is highly recommended. Second thing is do your research, right? Go online, see if there's a wand out there that is cheaper than mine. If there is, buy it. I would do the same thing. I'm always looking for sales online. Okay, if you don't find anything else, and I've priced it because I know there is nothing else cheaper out there, then you can go on my website and purchase the wand there. Okay, but I would, like, don't do it right away unless you know you're not going to be doing the massage with your partner. But I'm just going to put that in the chat box. I think that's the link for the one on my website. Just so you can go check it out. Okay, so that's my spiel about wands and perineal massage. But perineal massage is extremely useful for preventing tearing. The other labor and delivery prep technique that we're going to talk about is pushing. Okay, so everybody wants to know about pushing. People are taking, prenatal classes about pushing. I just want you to read kind of what it says on the slide there. Oftentimes, this is, again, what my clients are telling me. Usually in the hospital, women are being told to hold their breath and push really hard or push like they're having a bowel movement, which can be exhausting. And if you think about holding your breath and pushing, again, that can put a lot of pressure inside on the abdomen, the pelvic floor muscles, the organs, which we just talked about earlier, and it may lead to issues, okay? So also, when you are pushing and holding your breath, that may lead to the muscles tightening inside, okay? Just because that's kind of like if you think about somebody who has pulled their back when they're lifting something from the ground, usually what are they doing? They're holding their breath, okay? So the World Health Organization, American College of Obstetricians and Gynecologists, as well as the American Midwives Association, all advocate for anal holding breath, letting the woman do what she wants to do, okay? Breathing and pushing instead of holding her breath and pushing like we're having a bowel movement, and not directing pushing, okay? So these are some of the techniques that I like to go over with my patients, okay, just so you have different options, just so you have different tools in your toolbox, okay? You don't have to do what I'm telling you to do. It's just good to have different options, okay? And finally, Kegels. I'm so excited for this. Okay, so what is a Kegel, first of all? Because I know that word is being thrown around a lot. If you're pregnant, you're probably constantly being told, hey, did you do your Kegels? You should probably do your Kegels. Well, what the heck is a Kegel? Okay, so Kegel is a pelvic floor contraction, which means closing and lifting up and inwards with your pelvic floor. Okay, and research shows about 50% of women are not doing Kegels properly. Honestly, before I became a pelvic physio, was I doing a Kegel properly? No, it's because we cannot see the muscles inside. Okay, so if someone tells you, hey, do a bicep curl, okay, yeah, we can see those muscles, but also people then tell you how to do a bicep curl. People are telling you to do Kegels, but they're not giving you instructions about how to do a Kegel, okay, which is very important because Kegels can help prevent prolapse, leakages, faster recovery. And so we're going to go over Kegels right now. So I want you to right now just be in a comfortable position, ideally with back support. So important, okay? Because if your back is not supported, your ab muscles are going to try to kick in. Okay, but we're gonna go over how to do a Kegel. I just see something in the chat box there. Yeah. Okay. So Dawn, we're going to be going over that in a second. Okay. So yeah, just give it a couple minutes. Okay. So John just said, I find doing Kegels hard as my glutes contract as well. So how do I stop this? Okay. I'm going to instruct you on how to do a Kegel. So just good back support. And all I want you to do right now is do whatever you feel a Kegel is. Okay, just because I want you to feel that, and we're going to compare it to after I give you some instructions. Okay, so do a Kegel a couple times, try holding a few seconds, and then let it go. And then you're going to be doing it again one more time. Okay, so ideally at this point, it would be good for me to like see people when they're doing this because I can usually tell if someone is doing it correctly or not correctly just by looking at them without feeling the muscles inside. Okay. So once you've done this, the next thing I want you to do is to try doing a nice long inhale into your belly, okay? And then you're gonna do a 5-second exhale out through your mouth. Okay, we're gonna do that a couple times, and I just want you to pay attention to where the breath is going. Is it going into your chest? Is it going into your belly? Is it going kind of into the middle part? During pregnancy, it is harder to breathe into your belly, okay? But we want to breathe into the belly as much as possible. So if you're a chest breather, just like a lot of people, okay, I want you to put both of your hands on your lower abdomen. So go all the way down. That's where I want your hands to be, okay? And I want you to focus on doing a nice, long, slow inhale into your belly. Think about a balloon filling up, and then 5-second exhale out through your mouth. Okay, and you're probably wondering why she's getting us to do breathing. Because just like anything else, we want to breathe. Okay, so you don't want to do Kegels when you're holding your breath. You actually want to be doing them when you're breathing. Okay, most people tend to hold their breath, or they are trying to, breathe into their chest. We actually want to breathe into our belly. So do that a couple more times, just very, very slowly breathing into the lower belly. And then 5-second exhale, very important, out through your mouth. Very gentle. I don't want you going forcing it out, just very, very gentle. Okay, so now what I want you to do is, as you do your next exhale, that's when I want you to do whatever you think a Kegel is. Again, I'm going to be giving you more instructions in a minute, but as you exhale, make sure you start the exhale first, then you're starting the Kegel very slowly. Don't clench inside. It's a very, very slow contraction, okay? And you're doing it for the duration of the exhale. This might feel hard for many of you. A lot of people don't like doing it on the exhale. It's harder for your brain to exhale and then suck in inside, but that's how you do a Kegel. Okay, so try that a couple more times on the exhale. And then the next time you do a Kegel, okay, so on the inhale, you're relaxing the pelvic floor, let everything go. As you exhale, I want you to think about a marble at the vaginal entrance, and you're slowly trying to lift it up and inwards as you're exhaling at the same time. So if you need to close your eyes at this point, close your eyes. You can just listen to me, okay? So you're going to inhale, fill the belly, Okay, then start the exhale, start the Kegel slowly. And you should feel vaginally that you're closing and pulling inwards. Okay, your abdominal muscles should be pretty relaxed. They should not be contracting too much. So if you're finding you're having difficulty, it's probably coming from the abs. So make sure it's a gentle exhale. Make sure your hands are there on your belly to tell your abdominal muscles not to contract too much. The other type of Kegel I want you to try on the next exhale is think about stopping the flow of pee. So stopping urine. So inhale into the lower belly, and then as you exhale, that's what I want you to be thinking about as you do the Kegel. Okay, so try that a couple of times. And again, very gentle inside. Usually people are overdoing their Kegel. Don't try too hard. Focus on the breathing more than anything. Okay, so if you're, again, sitting up without back support, highly recommend back support and really focus on the breathing. Okay, so try that a couple more times. And I just want to see stuff in the chat box about how you felt and compare this Kegel to what you did previously on your own. It might feel the same, which is fine. It might feel different. Okay, most people inside, they're just doing this. They're not doing that inwards pulling. That is the most important part because that is what's going to prevent leakages. That is what's going to treat leakages, treat prolapse, and any other symptom that might be happening. Okay, and that is strengthening the core because pelvic floor muscles work with your abdominal muscles. So let's see, did anybody have difficulty doing that? How did that feel? Yeah, let me know. It's just good for me to know, but that's usually how I'm teaching how to do a pelvic floor contraction. Okay. And yes, so Melissa, great question. You can do these in many different ways. Most people actually tend to do them either lying down or sitting. That's usually how we start. Okay. But if you think about it, a lot of us are having leakages when? Okay, so 30% of you said you have leakage. When is it happening? Most of us, it's either coughing, laughing, and sitting, standing, or with exercise. Okay, so if you do Kegels lying down, and I've had so many patients come in and they're like, Nav, I've been doing Kegels on my own for 6 months and I'm still having leakages with running. I'm still having leakages with coughing. And I'm like, oh yeah, what position? Lying down. That's not functional. To start, it's good to do it to isolate the muscles. Okay, but pretty soon you want to do it sitting, standing. I usually am teaching if somebody especially wants to return back to, doing running, other type of exercise, even just, taking care of baby and lifting, we do Kegels with like squats, with lunges, with jumping, that kind of thing, because that's functional. It's similar to thinking about, okay, I want to train myself. I want to get, really strong, but I'm going to do bicep curls lying down. Not functional, right? Again, to start, it's a starting point. It's a good starting point, but we want to move away from that. Okay. And usually I'm recommending no more than 20 Kegels. So 10 stopping pee, 10 pulling on the marble. Okay. You don't need to do a ton of them, quality over quantity. Make sure you're not doing Kegels when you're urinating. Oh, biggest thing I hear when people come in, and when you're doing a Kegel, if you're urinating, your muscles are actually supposed to relax. Doing Kegels when you're urinating can lead to UTIs, infections, urinary retention. It's good to do it once and then just to know you're doing it and then do it in different positions. Okay, so hope that answers that question. Okay, so we are going to move on. Okay, so yeah, I want to really talk about C-section. Okay, so postpartum care. And this is part of that, but it's actually preventative care as well. So C-section rate, World Health Organization recommends it being between 5 to 15%. In Canada, it's closer to 30%. In the States, it's higher. In Brazil, it's 55%. Okay, many different factors can go into that. Okay, I am all about prevention. Okay, and so one of the things that can help is having a birth doula. Okay, I love doulas. If this is the first time you're hearing the word doula, that's okay. Okay, a doula is a support person. They're trained to support you during labor and delivery. And research shows, I'm all about research shows having a doula present can not only decrease the rate of C-section delivery by 20 to 6%, but also decrease the rate of episiotomy, the rate of forceps being used, rate of vacuum-assisted delivery happening, which is amazing. Okay. And so I realize, we have people from different parts of the world here today. But if you're able to access a doula wherever you live, that would be amazing because they can really, really, really support you during the labor and delivery process. Okay. If you're postpartum and you've had a C-section, okay, and there's so many things we can do. So we're not being told what to do. Okay. If someone had knee surgery, it would be like, okay, you got to start your exercises day one. We want to massage the scar. We want to, do all these stretching exercises. For C-section scars, there's nothing out there. It's absolutely crazy. So there's a bunch of different things you can do. Massage is one of them, using heat, silicone strips to help the scar heal, electric current therapy, acupuncture are different options, especially if you're finding there is pulling, tugging, pain, tightness, numbness, tingling, pins and needles. That can all happen after any type of surgery, especially C-section. And so that all can help you recover. I had a patient, actually not a patient, I had somebody message me on my Instagram and last week, and they had a C-section 8 years ago. They're still having pain and went to multiple doctors, not getting the care that they're supposed to get. She was being told, this is normal after surgery. No one would ever say that after any other surgery. And I have no idea. She found me, I have no idea how she found me. And she was asking me about how to take care of her scar and if there's any options because she's been suffering for 8 years. Yes, there are many options. So if you know someone who had a C-section, they're having issues. If you have had a C-section, just know there is care out there for you. You can reach out to me about the best option for you, but we need to definitely advocate for C-section prevention and recovery, I think, a little bit more than we're doing right now in healthcare. Okay. And then post-vaginal delivery, so postpartum recovery. So 6 weeks is the amount of time that everyone is given. Okay, so we're told oftentimes it's like, okay, at 6 weeks, you're good to go, return to sex, given clearance to return to physical activity. But what does that actually mean? There's actually no standards and guidelines for returning to activity, and that is for a few different reasons. Okay, because we don't know, everyone is different, right? So it depends on how labor and delivery went for you. Okay, so was there tearing? Were there instruments used? Was it a C-section? Okay, are you having issues right now? And so the biggest piece of advice I can give you right now is if you are having any of the signs and symptoms that we talked about, okay, please stop, please seek care, okay, because I just want to ensure nothing else is worsening. And also, we just want to make sure you're safely returning to physical activity postpartum. Okay. We're going to talk about in a second how physiotherapy can help. But it's just so important to realize that 6 weeks is given for everything. So if someone had, a wrist fracture, they're put in a cast for 6 weeks. What happens after that 6 weeks? The cast is removed, right? And they're like, oh, the bones have healed. Okay. They're not told you're good to go. After removing that cast, it's like there's weakness. You want to do physio, you want to stretch, you want to strengthen, right? Before just returning back to any type of physical activity. And then same thing for intercourse. If there is any tearing, when a physician or somebody else is telling you, okay, you can return back to intercourse, that's a huge fear that a lot of women have. Okay. So it's just important to know that it's good to be kind to our bodies. Okay. I have had clients return back to physical activity at 6 weeks. For others, it's been 4 to 6 months. Okay. Or longer. So we just want to assess what is safe for you. I'm just going to look into the chat box because I see 4 comments. Okay. Lindsay, yes. Lindsay is a friend of mine. She's in Calgary. She is a doula. So if anyone is in Calgary, please reach out to Lindsay because she can help support you during labor and delivery. Again, doulas are so important. And okay, so I'm just getting some comments about, so right now, actually, so yes, we can only have one support person in a hospital for labor in Alberta. Actually, and I think kind of Lindsay addressed this. So it depends on the hospital, it depends on your care team. I've had friends who are doulas, they've been able to go in for labor and delivery, depending on what the location is. So it depends on the hospital. Other times, you know, they are being restricted. So it is a very difficult time right now. But regardless of that, I have had clients who have had doula support ahead of time so that they can learn techniques, you know, breathing, pushing techniques, all that stuff ahead of time so that you are empowered and your partner is empowered at the same time. So thank you, Lindsay, for jumping in there. And virtual support is always, always available. It is so valuable during this time, and we're going to talk about that in a second as well for pelvic physiotherapy. But virtual support is very, very important because education is empowering. Okay. So we're going to talk about pelvic physiotherapy, and I left this at the end because I wanted to give you all that education as well. So what does a pelvic physiotherapist do? So how do we help? So if someone is wanting to prepare for labor and delivery, I've had people come to me pre-conception. They're like, hey, Nav, I'm gonna, you know, I want to try, we're trying for pregnancy, but can you give me strengthening exercises to do? That for me is like beyond ideal. That's amazing because in the clinic, I don't see clients until after the first trimester. So if I give someone those exercises pre-conception, that's awesome. Prevention is key. So if I've had clients come to me during pregnancy saying, you know what, I want an easy labor, I want an easy delivery, I want to recover postpartum, I want to get back to these specific activities. How can I do that? We specifically assess the core, the back, the hips, breathing, pelvic floor, um, abdomen, everything, and then give you specific exercises to do that are tailored to you to help with any signs and symptoms, to help prevent all that stuff. Okay, there are different options for you. Okay, so if you're not in Calgary, and regardless of if you're in Calgary, okay, so first one would be to go in person to a clinic near you. Okay, just ensure the pelvic physiotherapist you are going to does prenatal and postpartum care. Okay, because we work in different areas. Like I've done menopausal care, I've done men's health, men need pelvic physio as well. Okay, so just make sure they do prenatal as well as postpartum care. Okay, the other option would be a virtual physiotherapy. Okay, so when COVID started last year, clinics were closed, like they just shut down everything here. And so immediately we had to go virtual. I still had patients who were like, okay, can you teach me how to push? Can you teach me Kegels? Can you teach me perineal massage? Afterwards, you know, I have abdominal separation. What do I do? So we were then doing virtual care. So if you're in a rural area, if you don't have access to a pelvic physiotherapist, if it's more convenient for you at home, we do that as well. Okay. And that is something that is beneficial for a certain subset of people. Okay, and then we have in-home care. So I would say massage is probably more so something that's being provided for in-home care. Physiotherapy is as well. There's not a lot of pelvic physiotherapists doing in-home care, which means basically coming to you. Okay, and in-home care, myself, I am doing basically C-section release postpartum. Okay, using electric current for postpartum care. So if you want to see me, there's a couple different things that actually come into play. So first would be ensuring you have, like, if you could come to me or any other pelvic physiotherapist regardless of if you have insurance. Most of the time pelvic physiotherapy is covered, whether it's virtual, in home, or in clinic care, under benefits. Okay, but check with your provider. The other thing would be if you're booking in with a pelvic physiotherapist, knowing if you need a physician's referral or note. Most of the time these days you don't. Okay, used to be a few years ago that you needed a note for physiotherapy, but again, check with your provider. Just want to ensure that. Okay, and then book in with any physio. If you want to book in with me, I can only practice as per my license in Alberta as well as Ontario. So that's, I'm in Calgary, so I would be doing in person in Calgary, virtually in Alberta and Ontario. I can't practice outside of those provinces, which are basically states in Canada. Okay, but I can help you find someone. Okay. I have been helping other people find someone to, assist them during pregnancy as well as postpartum. I would just ensure that they are, doing pregnancy and postpartum care, looking at their bio and all that stuff. So if you have any questions about that, you can email me at hello@kaya.co, or you can send me a DM on Instagram as well. I think that's on the next slide here. Yeah, so any of those you can contact me and I can kind of help you figure that out. Okay, so I'm just going to check the chat box here. Okay, Lindsay, you're taking care of that. Thank you so much. Perfect. Okay, so what I want to now just talk about is, so I know we covered a lot in our chat. Okay, I didn't have enough time to fit everything in. We also have people who are postpartum, who are going through pregnancy. In 3 weeks' time, okay, we are going to be going over, so that's Sunday, May 16th, 9 a.m. to 10. We're going to be going over exactly how to do perineal massage, okay, how different ways of breathing and different pushing techniques, okay, and Kegels again, okay? I want you to practice your Kegels starting today up until next time I see you. Big thing I forgot to say about Kegels, oh gosh, I totally forgot to say this, is if you have pelvic pain, urinary urgency frequency, chronic constipation, I would highly recommend not starting with Kegels. Kegels are not for everyone, okay? Because if the muscles are tight, we don't want to make them tighter. We actually want to make sure we're relaxing them, okay? So if you're finding your symptoms are worsening or Kegels are not helping, it could be because the muscles need to be relaxed first, okay? But outside of that, I would want you to practice your Kegels